Hi, it's Mary from the Movement Studio, and I want to talk about a common pain pattern that I see all the time that is, with a little bit of awareness, you can help resolve some of the pain here. So the pain that I want to talk about is right above the shoulder blade. It could be on the right or the left side, but if you're right-handed, it's most likely right here above your shoulder blade, right sort of at the base of the neck and the top of the shoulder. And if you look at this diagram here, I drew a red X. And so that's the levator muscle. And it gets tight when the shoulder blade goes into downward rotation. So here's an example of a perfectly aligned scapula. So you look at the border here that goes along, so the spine would be here. That border is lined up correctly. This one, however, is downwardly rotated. As you can see by the arrow, there's a downward rotation. And pain happens right here. This muscle gets sort of overworked, and you can feel it if you press back behind your shoulder, how tight that spot gets. And what happens is, or the way to rehab that area, other than doing body work, is to work on the muscles that actually upwardly rotate your scapula. So that would be your middle and lower trap, and your trapezius muscle will help swing that shoulder blade into better alignment. Downwardly rotating the scapula, however, which is common at the gym, are working the rhomboid muscles, which is this rowing kind of motion, or a lat pull down. So if I had a bar overhead and I was pulling down, strengthening my lats, that actually can promote down rotation of the scapula if you're not careful. So if this pattern seems like something you might be in, and there's a bigger story about your core and how your core can feed into this, give me a call. We can do a free discovery session. I can talk to you more about this pattern. And before I go, I want to show you a simple stretch that can help dissipate the pain at that spot. Here is a simple stretch for that spot I was talking about. Now again, it could be on either side, but what we want to do is upwardly rotate your shoulder. So you could put your arm up a wall and just rest your arm up on a wall. Just be sure that you don't have shoulder pain or impingement here. But if my arm's at the wall, I'm upwardly rotated, and I would just look down and side bend away. Now if I don't have a wall, I can just put my hand kind of like I'm patting myself on the back, my elbows up in the air. I just look down and side bend away gently. Just be gentle here. That will isolate the levator muscle and give you a little stretch in that painful spot, and it might help some of your pain. Good luck with that, and be safe. I'll talk to you soon. Thank you.